Imagine if you had a friend who lost 100 pounds and looked like a completely new person. And then you saw them again after seeing them after that weight loss 3 years later. And you were curious to see what kind of shape they were in, how they were doing. And you met them and they looked amazing. And you're like, wow, you look great. And they said, I'm really upset because over the last 3 years, I gained 8 pounds back. You would be like, you look fine. Just, try to get into those good habits. You would reassure them. When it comes to orthodontic treatment, quite often patients will do a good job in that maintenance phase. When you have Invisalign during treatment, you're wearing it hopefully 22 hours a day, and then you go down to wearing it eventually while you sleep. That's the maintenance phase. And there has to be an acceptance that there can be some very small changes that hopefully the patient won't even see or feel. But when it becomes an issue, I'm not talking about people who completely stop wearing the retainers and now their teeth get really crooked. But this video is going to speak to something that happens quite often. You have a patient who is 5 years out of treatment or 10 years out of treatment, and we're going to grade them as, say, a B plus retainer wear, meaning they still wear their retainer, but they've missed a week here or there. They were in the hospital, they went on vacation and they forgot it. And this is a common thing. I'm not passing judgment. There's medications I need to take every day that I sometimes just completely forget about. So there are gyms that I've joined and I didn't work out. But the point is, if you're a B plus or a B retainer wearer and you now have a retainer that is microscopically not fitting ideally, it will impart some tightness on the teeth. Now, you may still be able to put it on and that will kind of reassure you. But when that retainer is lost or when it breaks, and a lot of times it will break because of this stress that the teeth have moved a little bit and patients try to force it on, then you need to get a new retainer on the way the teeth are. If you expect to just have the retainer replicated from the way it was 5 years ago, it's going to be a stiffer plastic because it's brand new. It's not going to adapt to the teeth. And what's going to happen is it's going to stress the ligaments around the roots of your teeth, and they're going to expand and swell, and you're going to have this back and forth situation. Orthodontists know that we have new patients that come in and they say, hey, I have this retainer and I have this gap between my teeth. And when I wake up in the morning, the gap is closed, but by the end of the day, it opens. Retainers that move teeth, it's just too harsh. And because of that flexure and inflammation of the ligament, there's going to be a back and forth type of situation. So if you are an orthodontic patient, you might want to get 2 retainers at the end of the treatment so that you have a backup or a future retainer ready to go. And if you lose your retainer, you should not expect to be able to just call up the orthodontist and have them send you something that was made 5 years ago. We get this call quite often. And I actually think, and I'm speaking now to my fellow orthodontic colleagues, that it's a little bit irresponsible to just mail a retainer if you haven't examined a patient. Now, if somebody comes back to our office with a retainer that's 10 years old or 5 years old, fitting perfectly, yes, I will consider remaking that same thing because the records are there that you can do this, but patients become insistent on this. And we get calls from people that say they don't live in New York and they want to have their retainer made back from 2018 when we finished treatment. And the more insistent they are when we tell them that we need to examine them, the more I believe that they have gotten used to this situation where they know their teeth have moved and they're trying to use the retainer as the tooth alignment device. And as I explained, that is not a way to stably correct the teeth. So if you are out there and you have a retainer that you wear periodically and you think that that's doing the job, that's okay. But eventually you're going to need a new retainer and you should go back to your orthodontist. And if you're uncomfortable with it now and it's too tight and you know you haven't really worn it that much, even though I just said it's okay, I would recommend you go back to your orthodontist and have a new retainer made from the way your teeth are at that point in time, which probably looks fine because you're not going back for retreatment. But you can't have the perfect alignment unless you stay on top of this with either perfect wear or different treatments over time. Orthodontic treatment is not a cure, it's a treatment. So some people come back 8 years later and their teeth have regressed a little bit, and we do a treatment that could be 2 or 3 months instead of a year at a much reduced fee. That's how you can realign teeth, but you can't do it by expecting to just get a retainer chip from you that you jam on your teeth. And I did have this issue with a patient who said, my teeth still look fine, but they look better when I wore that last aligner, but I lost it. And so I don't want to go through another treatment. No, that's what you need to do, is go through another treatment if you want it perfect. And if you want to just maintain it, the best thing to do is get a new comfortable retainer that will be light and passive as opposed to tight and prevent any further movement.